I'll be having an information session today on injury called shoulder dislocation. And as you just seen in the video, we saw quite a high impact on the shoulder there that results into a shoulder dislocation. There's different types of shoulder dislocation. The most common one is anterior, which is at the front, posterior at the back, and anterior inferior, which is down at the front. Alright, now let's go on with the signs and symptoms of a shoulder dislocation. The first one will be obviously the pain. You will feel a lot of pain, it will inflame, so pain and discomfort, and then inflammation, and then in some cases you will get a shape transformation, quite obvious. In this picture here we see the bone is sticking out, and that's a normal shoulder. So we see there's quite a big difference into the shape here. It can get also red, some redness, some bruising. See, there's some very dark spot here. The picture is black and white, so we don't see it very well, but usually it will be all sort of colors: blue, black, yellow, rainbow colors. And then another sign will be a lack of the range of motion. So obviously the first few weeks you won't be able to move your shoulder too much. Okay, so now it's time to pass it on to my assistant, Anna. She will talk about her own experience about her shoulder dislocation, and then we'll get into the treatments and see how we can treat these shoulder dislocations.
Hello, as Dr. Michelle said, I have been in a recent injury where my shoulder was dislocated during a volleyball incident. So instantly after it dislocated, I felt extreme pain in my shoulder and I couldn't move it at all. And I was lucky enough to only have a partial dislocation, where sometimes it can be fully dislocated, and so which is called a complete dislocation. So I had to go through some of these treatments, and so if it was a complete dislocation, I would have had to go to the doctor and get what's called a closed reduction, which means that the doctor does some special treatment and they have to put the shoulder back in the socket. That can be very painful, but as soon as the shoulder is back in the socket, the pain is reduced immensely. Then we go to immobilization, where the shoulder, it shouldn't be having too much movement after it's been dislocated, so we have it in a sling for about 3 weeks. And then after that, then we go and we get go to the rehabilitation center and we get therapy on it. So the physiotherapist will do lots of exercises to gain range of motion back in the shoulder. And in extreme cases where we continue to dislocate our shoulder, we sometimes have to get surgery, which is just tightening the shoulder up so it's not as loose, so it doesn't get, so it doesn't dislocate as much. To prevent any further dislocations in the future, it is very important to go to your physiotherapist and make sure that you strengthen your shoulder. So rehabilitation is one of the most important procedures in the treatments.
And you do have to make sure, the rehabilitation assistant and the physiotherapist have to make sure that you follow the process properly. Then you get strong enough, and then in this case you don't have a reoccurrent situation to happen. So yeah, thanks a lot for listening to us today. Hope that helps to understand and know a bit more about the shoulder dislocation.